regarding the circle of Willis, also called as cerebral arterial circle or the circulus arteriosus. This is an important applied anatomy for the MD medicine residents. We will see what are the arteries and where are all it's supplying. Basically, it connects the two important systems, that is the internal carotid artery and the vertebrobasilar system. It's connected, where this is the circle of Willis. How it is going to connect? It is going to connect to the various branches. As we know, internal carotid artery comes from the common carotid artery, in turn comes from the arch of aorta, whereas vertebral artery is from the subclavian artery. See, here is the subclavian artery. The vertebral artery comes from each side, from right and the left, and joins to form the basilar artery. Here the common carotid comes on the right side, left side. This forms into external carotid and the internal carotid. This forms the anterior circulation system for the brain and the posterior circulum. These both are connected by the circle of Willis. So this is the representation image for the circle of Willis. So this is the cutoff between the anterior arc and the posterior arc. What are the components? It is found by the 4 paired artery and 1 unpaired arteries. First is the from the basilar artery, the posterior cerebral artery. This is the first one on both the sides. Then is the posterior communicating artery, which is the branch of the posterior cerebral artery. This is the internal carotid artery on both the sides. Then is the anterior cerebral artery. These both are connected by the anterior communicating artery. So this forms the circle of Willis. Here another important branch is the anterior choroidal artery, which is the branch of internal carotid artery. So this is the representational image. Where it is located, it is mainly located in the subarachnoid space. What is the importance of the circle of Willis? It forms the balance between the anterior circulation and the posterior circulation. Even if one of the major arteries is blocked, since these are valveless, like there will be passage of supply from the posterior to the anterior circulation freely. Basically, it forms the collateral circulation and protects the brain from any type of blood insufficiency. So this is another representational image for the vertebrobasilar system. Here the vertebral artery comes. There are 5 branches for the vertebral artery. The first is the anterior spinal, posterior spinal, the medullary branches. This is the pontomedullary junction. It is the upper part of the pons. This anatomical landmark is very important because the clinical diagnosis we can locate where the vessel is involved. The important first to anterior spinal, posterior spinal, medullary, the end branch which is the basilar, and the pica, which is the important branch of the vertebral artery. Pica is nothing but the posterior inferior cerebellar artery. And from the basilar artery, again 5 branches are there. Important branches are Fontaine branches, the labyrinthine artery. Then this is the anterior inferior cerebellar artery, posterior cerebellar artery, and the superior cerebellar artery. So if we take the cut section of the cerebellum like this, then you can clearly see where this pica supplies, where this ica supplies, where the superior cerebellar artery supplies. Mainly the cerebellum. Here the brainstem also mainly supplied by this. What is the applied anatomy of this one is the lateral medullary syndrome and the median medullary syndrome. The features depends on the which vessel is involved and the which side is involved. So this image is very, very important. So there are 5 branches for vertebral artery, 5 branches for the basilar artery. You have to aware. Then we will see the cross section of the brainstem like midbrain, pons, and the medulla. Then we will understand the syndromes. So this is the exact blood vessel and the location, how it is located, the circle of Willis. Inside the circle, the pituitary stalk and the optic chiasm is located. So this is the posterior, this is the cutoff for the posterior and the anterior arc. This is the posterior arc, which is the component of the vertebrovascular system. See the two vertebral artery, we are having the anterior spinal, posterior spinal, then posterior inferior cerebral artery, pica, then these medullary branches, then forms the basilar artery. The basilar artery, it is the ica, labyrinthine artery, pontine branches, and the posterior cerebral artery. So here we are able to, I will mark it again. Here is the posterior cerebral is going here. This green color marked one is the posterior communicating, then comes the internal carotid artery, posterior communicating artery, posterior cerebral artery, then the anterior cerebral artery, and the anterior communicating. So these are all the paired one, this is the unpaired one. And any of the aneurysm can compress the nerves. For example, between the posterior artery and the superior cerebral artery, third nerve is located. And the aneurysms are common in the circle of Willis. The aneurysm can occur here. The most common is in the anterior arc. So this structure is very, very, very important. Whenever there is a sudden occlusion of any blood vessel, the collateral usually tries to compensate for the decreased blood supply. But whenever there is a complete occlusion, the lesion manifests as per the which vessel is involved. For example, if the anterior cerebral artery is involved, more of the medial part of the brain is involved. As we show in the representational image, the manifestations will be similar to these location. If the middle cerebral artery is involved, this is more of the lateral part of the brain. If the posterior cerebral artery is involved, more of the occipital lobe involvement. If the vertebrovascular system is involved, more of the brainstem cerebellar symptoms, where you have lateral medullary syndrome, medial pontine syndrome. So for this structure is very, very important. And what is the another important artery we have to know is the anterior choroidal artery, which is the branch of internal carotid artery. This supplies the basal ganglia, internal capsule and all. So this is also important, but this is not a part of the circle of Willis. So this is the all about applied aspect of the circle of Willis. Subarachnoid space, 4 paired branches, 1 unpaired branch, basically connects between the anterior circulation and the posterior circulation.